Hello, our names are Leary Mustafa, Kayleen Simmons, and Sierra Kennedy, and we'll be presenting our public health capstone research regarding the effects of substance use on family members with a particular focus on Hampshire County. We will take you through the background of our research, our methodology, the results, and the proposed recommendations. Substance use disorder is a disease that affects a person's brain and behavior. This leads to an inability to control the use of legal or illegal drugs or medication. Oftentimes, substance use disorder is viewed as an individual disease, focusing on the substance user and neglecting the detrimental side effects that substance use disorder has on family members. It is estimated that over 100 million people worldwide are negatively impacted by a family member's substance use disorder, and consequently suffer social, psychological, and physical problems. On a national level, approximately 46% of United States adults reported substance use issues within their family. In 2019, the National Center on Substance Abuse and Child Welfare calculated that a national average of 38.9% of children who were removed from their homes and placed in out-of-home care had substance use as an identified condition for removal. Meanwhile, on a state level, the Massachusetts percentage of children removed due to parental alcohol or drug use was slightly below the national average at 31%. Furthermore, Massachusetts was ranked as the state with the second highest prevalence of substance use disorder among adolescents and adults, with 9.83% of the population being affected in 2016. For this project, we will particularly focus on Hampshire County, a collective of 20 towns located in western Massachusetts, with an estimated total population of 162,308 people. In 2021, 22.5% of the Hampshire County population reported excessive drinking, which is defined as binge drinking or heavy drinking. The same year, the county experienced 126 drug overdose deaths, amounting to a drug overdose mortality rate of 26%. The year prior, in 2020, the Massachusetts Department of Public Health reported 34 opioid-related overdose deaths in Hampshire County. Analyzing the risk and protective factors that contribute to substance use disorder and those affected by the user is important in creating and selecting effective interventions. The main risk factors include, but are not limited to, mental health and the development of mental health disorders, family instability, and social issues. On the other hand, protective factors consist of healthy, trustworthy relationships with others, stress-relieving outlets or hobbies, and access to support groups and affordable counseling resources. We understand how substance use disorder affects families and how prominent it is in both Massachusetts and our target population of Hampshire County. Therefore, using databases such as PubMed and PsycInfo, our objective is to explore current intervention programs intended for affected families and suggest an intervention plan that may be implemented and made available to the Hampshire County population. Overall, we identified 8 intervention studies. 6 were conducted in person. There was 1 case control trial, 3 randomized control trials, and 2 non-control trials. The study populations ranged from 59 to 271 participants. The studies were performed in a range of duration from 4-day interventions to 6-month interventions, and many included follow-up surveys and questionnaires. 2 of the identified interventions were web-based, and both were randomized controlled trials. Respectively, the populations of the studies were 306 and 223 participants. Overall, throughout all 8 interventions, the participants varied from children, adults, families, and spouses of substance users. The studies assessed outcomes related to mental health, child abuse, relationship quality and functioning, and family conflict and parenting practices. There were a couple limitations to the identified interventions. For one, a small sample size acts as a limitation to certain studies, especially those with, for example, 23 and 59 participants. Small samples yield low power for detecting clinically relevant effectiveness. 2 of the interventions were not randomized, limiting the ability to infer causality. Lastly, one study focused on military substance use, and according to demographics, over 90% of military spouses are female. Therefore, the study sample targeted female concerned partners and consisted of mostly young, white women who were married to male service members and veterans. The study did not account for male concerned partners or same-sex relationships, nor their perspectives. Future research is needed to extend the findings to other populations, such as other concerned family members. Based on the effectiveness of previous interventions, we recommend the implementation of 2 programs: community reinforcement and family training, otherwise known as CRAFT, and a web-based intervention. The CRAFT model aims to increase the rate of engagement of substance use disorder individuals in treatment. However, it also focuses on family connectedness, allowing families to reflect on the user's actions, and helps loved ones prioritize themselves and their mental health rather than blaming themselves for the user's addiction. Previous interventions found that this model showed significant reductions in depression, anxiety, anger, and physical symptoms. Additionally, CRAFT provides a promising alternative to the confrontational and detachment approaches generally used in counseling family members to help their loved ones. Meanwhile, the web-based approach follows the recent shift towards telemedicine. Previous web-based interventions found significantly lower levels of anxiety and higher levels of social support among family members of substance users. There were also reports of significant improvements in relationship quality and family conflict. Ultimately, proposing an in-person and an online intervention option aims to increase accessibility to services and aid. Thank you for watching and listening.